Hi everyone, my name is Luke. I'm going to be presenting on the torrential rains in the Caribbean islands. So, torrential rains have caused severe flooding, with entire communities being submerged and stagnant water lingering for several days. Plenty of lives have been lost, and many people continue to remain missing. Roads, bridges, and sanitation systems have all been destroyed, and this has created serious access and hygiene issues. What's even worse is the floodwaters have become a toxic mixture of sewage, chemicals, and decontamination remains, and worst of them all, bacteria. And all of these have contaminated the environment and further raised the risk of disease. Basic needs like clean water, food, hygiene supplies, these are all becoming increasingly scarce. And mold is rapidly growing in remaining shelters and buildings, which continues to pose serious health threats. In this context, health officials are sounding alarms about outbreaks of waterborne and foodborne illnesses, specifically Salmonella, E. coli, and norovirus, which all of these spread quickly without proper intervention. So, for priorities and roles, the top clinical priorities in a disaster like this includes triaging and stabilization. So, victims must be sorted by their injury severity, not necessarily their treatment routine. Rapid infection control, so like all open wounds should be cleansed immediately. And the CDC warns to never let a wound touch floodwater. Um, and lastly, access to clean food and water to help prevent dehydration and malnutrition, especially in vulnerable groups such as children, elderly, and those who have chronic illnesses. From a public health standpoint, we must help monitor for these disease outbreaks, identify hazards quickly, and deliver clear education on hygiene, mold cleanup, and food safety. Nurses will also be working with local and global teams to organize care delivery and ensure continuity of services such as chronic disease management and mental health support. Following the floods, there's many diarrheal diseases that spike. So, contaminated food and water are the primary causes. If floodwater touches food, it must be discarded. With power outages, refrigeration will fail, and this causes perishable goods to spoil, and this will disrupt the food cold chain. Hand hygiene and safe drinking water become absolutely critical, especially in overcrowded shelters, shared kitchens, and restrooms. These all increase transmission risk. Those most affected are children, older adults, and individuals who are immunocompromised. Responders themselves will also face hazards during the cleanup due to the broken sanitation systems as well as mold exposure. And consistent, understandable health messaging will help to empower the communities to reduce their risks and protect their health. So, effective relief efforts look like prioritization of safe water and sanitization while launching rapid disease surveillance to detect outbreaks early. Next, it'll entail discarding contaminated or spoiled food and working with um, restored refrigeration as soon as possible. Mold cleanup should begin within 24 to 48 hours. And according to the CDC, porous materials should be dried, cleaned, or discarded. Relief teams should also redistribute hygiene kits and provide clear, culturally relevant guidance on how to use them. Now, resources for disaster response will exist on three separate levels. At the local level, this includes community responders, evacuating residents, helping to set up shelters, treating injuries, and restoring sanitation. At the national level, this includes ministries of health and disaster management agencies that are going to be coordinating logistics. They're going to be disease monitoring and conducting lab testing, which is going to be guided by regional groups such as the Caribbean Public Health Agency. Now, at the global level, the Pan American Health Organization, which is a branch of the World Health Organization, will support surveillance, outbreak response, clean water initiatives, and public communication. So, moving on to ethical considerations now. Disaster responses must respect local cultural and spiritual practices. Aid must be distributed equitably, meaning not taking into regard someone's religion, ethnicity, or their income. All communities deserve informed consent, even during emergencies such as these. Communication should use local languages and dialects, and trauma informed care includes mental health support, access to religious services, and protecting human dignity, especially with how diseased individuals are handled. Planning for disasters must begin before they happen. So, this means involving community leaders, elders, and clergy in response plans. Responders need training in cultural humility, gender sensitivity, and privacy protocols. Public health alerts must be translated into local dialects. Long-term recovery should include spiritual rebuilding and mental health services that honor local healing traditions. And nurses use a structured process to lead this response. So they're going to be assessing population needs, risks, and vulnerabilities. They're going to diagnose priority threats during disasters such as injury, infection, dehydration, or mental trauma. They'll be planning and coordinating care that's equity focused, um, and intervening with local and global partners. They'll be implementing care, education, logistics, and support for both individuals as well as communities. And finally, they're going to evaluate outcomes. So they'll adapt strategies based on changing needs and community feedback. Finally, we'll talk about principles and scope. So disaster nursing extends beyond clinical care. It involves technology such as telehealth and mobile apps, mental health support for both providers as well as survivors, and collaboration across several sectors. Most importantly, it demands compassion, equity, and cultural respect so that we can care for people not just in crises, but with dignity as well as justice. Here are our references. And that concludes the end of this presentation. Thank you so much for listening.